Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So if you have a painful hip, we're going to show you 5 exercises and stretches that you can perform in bed in the morning. So you can get this going right away.
Right.
Now this video repeats some of the exercises mentioned in another video called Bob and Brad Stretching Program for Hip Pain based on the MCKENZIE approach.
Sure.
So, these exercises, we usually want you to perform them like 6 to 8 times a day if you can. So if you can.
Right. Right.
So if you're going to be off to a good start if you start in bed.
Right. You don't have to do them that many times a day forever.
No.
Just until you get things moving, and then you can start to decrease to a maintenance program.
Yeah, good point, Brad.
I don't want you to
get
tune
scared
us out
away
because it's too crazy.
Yeah. I mean, if you can only do it twice a day, you do it twice a day. Or if
Sure.
you only can do it once a day, you do it once a day. But
It's a lot better than not doing it at
yeah,
all.
that's right. So Brad's going to demonstrate the
Yeah.
lying in bed and showing us. He's got a stretch out strap too.
Which I don't think we showed in the other video.
Oh,
for
I
that
don't think we
particular-
did. No.
Yeah. So this gives another alternative, and
Yeah.
I think it's very helpful myself.
Yeah, you don't need to have it, but,
Nope.
but we're going to show you. For some people, it would really be helpful because they have trouble reaching their legs.
Are you ready?
Yeah, I'm ready.
All right,
So, do
so-
you want me to tell you what to do?
Oh, sure. We're going to start out. So you're in bed. You can leave your pillow behind your head so you're comfortable. You want me to? You wanna bring your knees
Number
up?
1 is trunk rotations.
Yep. So we call this hook line rotation. You don't need to remember that. But feet are together, knees are together. You should be relaxed and breathing. Just relax. And I always call it the windshield wipers to my patients because the knees stay together. Don't let them separate.
And the ankles stay together, 2 feet stay together.
My hip will come up. My shoulders will stay flat on the bed. You get some low back range of motion here as well.
Yeah, and the thing about this, it's a warm-up exercise.
Yep.
It's a great warm-up exercise. Now, if for some reason it does hurt going in one direction,
Ow, ow, ow.
yeah, avoid that one.
Yep.
Just go to the other direction to start off with, and then once in a while test back again and
Yep.
see if it's loosened up.
A lot of times it will improve
Yep.
when you work the other side.
Yeah, if your hip gets really stiff at night with sleeping in bed, this is a great warm-up for it. So.
And just remember, if any of these create any pain or sharp pain, you need to avoid it, or just like this, do the other side or do the pain-free range that's
Yeah, we're
tolerable.
not interested in increasing your pain,
Right.
so we're trying to take it away. Next one, number 2. That was number 1. Number 2, hip flexor stretch.
Yes.
So he's going to stretch the muscle right here where your front pocket is, and that's a very important muscle, by the way, to make sure it stays loose.
So you can do this one off the edge of the bed, but be very careful that you don't slide your whole body to the edge
Yeah,
because you'll fall right off possibly.
Keep the shoulders well
Yeah,
on.
the shoulders are on, so you're going to be at an angle a little
Yeah.
bit. Scoot your right, if this is my right leg, my right buttock is going to be slightly off, and the gravity does the stretch on this one.
Now you can also anchor there you go, anchor the pelvis, and you can see that actually pull the leg up when he does that. It shows a little bit of tightness in the hip there.
And you can feel the stretch increase a little bit when we do that. Actually, in my case, it feels really good, and that's particularly if you get that good stretch feeling. Boy, work it some more.
Now, if you have trouble pulling that leg up, that's where you might use the strap. Correct, Brad?
Oh,
Yeah.
you mean to
Yeah,
get around it like
exactly.
That? Yeah, that is one nice.
And it's got loops in it, so
Yeah.
you can keep it easy on your fingers and hands.
Yeah, 'cause-
especially if you have arthritis in your hands.
Yeah, exactly.
You can just use the wrists.
Yeah.
With arthritis, you always want to transfer stress to larger joints if you can. So stay away from the finger joints and transfer it to the larger wrist or forearm.
Now, if you're asking how do you do the other leg, you either have to go to the other side of the bed or
you
get
gotta
up
flip around.
and turn around. It's a little inconvenient, but there's nothing we can do about
nothing we
that.
could do about that. All right, next one, you're going to basically work on hip flexion or hip bending.
Right. So one leg at a time is probably the best way to do it.
Yeah.
You can grab behind your knee or here in the hamstring area or here. If you have a hard time, I've had a lot of people that have a hard time reaching their leg. You can use a belt You can use a stretch out strap. You can use a towel. Again, the stretch out strap has got the big advantage of if you have difficulty with gripping.
Yeah, it's got loops. And, you know, I'd say with most of these, you want to do like 10 times, pressure on, pressure off. Pressure on, pressure off. You say the words, it actually tells you how long to do it then. Pressure on, pressure off.
If you want to hold it for a sustained amount of time, that's an option
fine
too.
Yep.
Whatever feels better for you. I wouldn't go more than 30 seconds. So.
You mix it up. All right. That was number 3. Number 4, figure 4.
Oh.
How that worked out, Brett, huh?
Yep.
A figure 4 for 4.
So,
yeah, go ahead.
So with your legs flat, you can do this 2 different ways. You're going to take I'm going to focus on the right leg. Your ankle bone goes above the kneecap on the other side like this. And then you let gravity bring this down. And if you want, you can do a gentle push on it.
Let's see how he makes a 4 here.
Yeah. Now, you might do this on the other leg and it doesn't go near as far because it's tighter. Well, you may want to focus more on that leg.
Yep, that's where you can see the discrepancies between the movement of the
Right.
hips.
And then should we show them the advanced?
Sure.
So this knee will be up. If that's too easy for you and you want more of a stretch, same thing, but bring the other knee up, place the ankle there on the thigh. And this works out well because you can usually take your hand and give a little gentle pressure here.
Yep.
And, of course,
Great
the
one.
other leg. What number are we on, Bob?
That was number 4.
Okay.
Remember, figure 4.
Do we want to show the option with a strap with
Sure.
this or wait till later?
Sure, no, go ahead.
Okay. So this is how I do it on my routine. I take the strap, I put it around my foot, which is nice. And then, you know, you can use this for flexion, like this. And then I'll do the figure 4 like this, so
go
you don't
right
even
into
need
it.
this leg.
Sure.
And then
You can
I'll add internal rotation, which we're going to show another way to do it without the strap. But with the strap, I just do this and then stretch it here.
You're probably getting your hip flexor a little bit on that.
Yeah, a little bit.
Quad probably more.
Yeah, you can feel it.
Rectus
It's a
femoris.
good stretch. What I really like about this is I can do my hamstring, I can do my hip flexor, I can do figure 4 this way, and it's
Yeah,
very
you just-
efficient.
yeah, very
just
efficient.
whip right through it.
Go right through.
It works
Yep.
well.
All right, so last one, number 5, is hip internal rotation. Brad just kind of showed that, but basically you're trying to move the hip. Yeah, go ahead, Brad. You show it.
So the right leg I'm going to do, it's a little, you know, some people might find it a little confusing, but you take the opposite leg, cross over the top of the knee, and you think about putting the inside of the knee down towards the bed, and you get that stretch. And you can change the position of your foot. If you're tighter, you'll pull it this way. If you want to get more aggressive stretch, go the other way.
Sure.
There's little things that you'll probably, once you do it a couple times, you'll get a feel for what your body wants.
Keep your
best.
shoulders down.
Yeah.
Don't let them come up.
Yep.
Yep.
Now I got to do the other leg so I feel balanced, Bob.
There you go. Don't walk in the circles of Brad. All right. This is part of a program on hip pain that you can find at bobandbrad.com. Go to the program section, find the hip pain videos,
Yep.
and we will have titles that you can check out and watch the ones that pertain to you.
Right.
And if you want to, we also have a printout.
Yeah, big benefit. Just a PDF printout. Just print it out so you have a piece of paper with a review of the video, pictures of the exercises. It is really a convenient service that we have here. We don't ask for your email, no nothing. It's completely
There's
free.
no charge.
You bet your.
This is our gift to you.
You bet.
Thanks for watching.